It's been suggested to me by somebody who works in the HSE mental health services in the Midwest that there's no consistent or coherent plan around when or how to return to face-to-face meetings. Could I invite the HSE representatives to comment on that, whomsoever wishes?
So what we're attempting to do at all times, and as you're aware, the guidelines can change, is to stay within the public health guidelines. And as part of the return to business protocol, that's been published, and that needs to be worked out on an individual area basis, because you can have principles and guidelines, protocols, but you also need to be able to implement them. So each of the areas at the moment, as we speak, are actually looking at their own premises and their own services in order to look at how exactly are we going to meet the twin approach of return to some degree of normality. Then
it is correct to say that there is no consistent plan in place yet. It's still being worked out.
Well, what's happening is that the guidelines that have been issued need to be implemented at local area level.
So they haven't been implemented yet at local area level?
I think we're in the process of doing that, Deputy.
Okay, thanks. Then with regard to more remote care, it's been suggested that rather than having smartphones, that the staff have Nokia 3210s. They're the kind of phones that they used to use in love-hate for very different reasons. And that they've no handsets. They're still waiting approval of video conferencing facilities. Could you care to, and this is several months into the coronavirus restrictions, would you care to comment on that?
As deputies can appreciate, there was once COVID hit, we had to look at all ways in trying to make sure that we could try and continue to provide services. And from an ICT point of view, that posed significant challenges. However, there's been huge developments over the last couple of months, probably greater than we would ever seen feasible. And the issue you raised there about devices, that certainly has been a difficulty over the last period of time, but we would hope that that will no longer be a difficulty into the future, because our investment in those devices will help to meet the demand. Also, Deputy Riley mentioned earlier about face-to-face. What we're looking at trying to do is have a blended approach, so that those who do need face-to-face can have that access, but that we also make sure that we try and maintain a level of service and we use technology to the best advantage. But as you've outlined, that coverage across the country can be sometimes patchy, and that's something that we're working on a daily basis.
Thank you. Excuse me, I'm looking at a WHO report on COVID and mental health, and it states reports from Chile, Italy, Spain, the Philippines, the United Arab Emirates, the United Kingdom and the United States of America document how dedicated teams provide mental health support for healthcare workers. Were there any such teams, dedicated teams in the HSE or anywhere across mental health services providing mental health support to frontline healthcare workers?
So that in this country, the way we've done that is through our psychosocial response. And as Dr. Niazi mentioned earlier, we have specifically arranged for counselling services through Silver Cloud. And I understand there's been about 3,000 counselling sessions taken up by our 3,000 staff. The HSE have taken up that offer already. So what we've done is that we've used technology, I suppose, in a way in which to our benefit. I think, Doctor, that's probably the main way in which we've addressed it.
That's the main way at the moment.
Thank you. Lastly, I suppose would you agree that the impact of COVID-19 and the restrictions which were necessitated had a negative impact on mental health?
Yes.
Or not?
I think they've had a negative impact across the whole range of health services, and notwithstanding in mental health.
So I'm not saying a negative impact on mental health services, but a negative impact on the mental health of the population.
Yes.
Yeah. Given that, do you think it's either surprising or alarming that there was no mental health representatives or representatives of psychiatry on NEFID when all of these decisions were being made?
I don't know. I don't think that's...
Maybe, if you don't wish to comment on that, maybe the Mental Health Commission might wish to comment, and if they don't, that's fine.
My understanding is that Dr. Siobhan Nivreen, who was previously the clinical lead in the HSE, was on the NEFID.
But my understanding is not as a representative of mental health or psychiatry, but rather in her new role. Is that correct?
Yeah. Well, I don't know, but I know that we inputted into the structure in terms of the vulnerable person as well, and there was a fair bit of professionals who understand mental health feeding in. I suppose the context is now and getting ready again when we know we have a service that, and I really want to reiterate this, I really wouldn't want it to get lost, and I appreciate that the mental health of the nation and individuals is important, but within that there's highly vulnerable people with mental illness who really need to get the service, and I suppose for me they're the ones that I really would like the HSE to concentrate on building a service for people with mental illness.
Okay, you've been very clear with that message, Mr. Farrelly. Thank you very much.